All right.
Okay, so I'm a professor at the Graduate School of Public Health at the University of Pittsburgh. And I work with fly ash, and I work with coal combustion waste, and I work with coal power pollution. I also work with coal. And we look at its bioaccumulation in fish and in people and relate the two. So we look at animals and we look at people and we look at the body burden of these minute trace metals in people. What I want to do for just a minute is give a little bit of a science lesson. And if you'll just bear with me, I'm going to do it for a reason. And it's really threefold. One, I want you to understand how dangerous fly ash is, number one. I want you, secondly, to understand how you can be exposed to it. And thirdly, I want you to know how you can protect yourself from it. So has anybody in here ever heard of the law of conservation of mass? Few of you. A couple people have heard of the law of conservation of mass. It's a scientific principle, okay, that matter cannot be created nor can it be destroyed. It's a really important point. What it means is a lump of coal, when it's burned in a power plant, what doesn't go up the chimney and out the stack, or what doesn't go out into the wastewater, stays in the fly ash. Okay? Because it can't change. You can actually transform mercury into other forms of mercury. You can transform arsenic from one form into another form. But you can't change the amount of arsenic that is in the lump of that coal. Its total stays its total if you add what goes up the chimney, out the wastewater, and into the fly ash. And what that means is, pound for pound, fly ash is far more toxic than coal. Okay? Pound for pound, fly ash is a highly, highly toxic substance that includes a plethora of heavy metals and elements. And as I look at it here, you have some specifically very, very high levels of arsenic in the water right now. 35 to 300 times the EPA's drinking water criterion. In fact, this level of 1.083 parts per million near the breach site, and even the 356 parts per billion at the power line crossing about 2 miles downstream, they're in the that arsenic there is in the level that if you're chronically exposed, you could expect to develop liver cancer to those kinds of levels. Now, I'm not saying you're going to be chronically exposed, but I will tell you that exposure to arsenic, even at very low levels, and we're finding out even levels below the EPA standard, quite frankly, can cause what's called angiogenesis of the liver. And what this is that your liver actually starts to seal off those spaces that it uses to filter the blood, okay, in your liver. And it seals it off and it makes a capillary. They actually used to give young women, when they came of age in England, they used to give them little doses of arsenic. They used to give them arsenic so that it would make their cheeks red. It would make their veins pop out and their arteries pop out, actually grow more arteries in their cheeks so they wouldn't have to wear blush. They'd look more attractive. I mean, we did this kind of nonsense at one time. But what I'm trying to get through to you is that even at very, very low doses, arsenic actually can cause this angiogenesis of the liver. The other thing you need to understand about arsenic is that it is a pulmonary toxicant, meaning it's toxic to your pulmonary system, whether you breathe it or you take it in by ingestion. It doesn't matter. Once it gets in your body, it does the same things to those pulmonary epithelial cells that it would do if it was, even if it was breathed in.
Your lungs.
Yeah,
Lungs.
your lungs. That's right, in your lungs. Even if you drink arsenic, it affects your lung system, as well as your liver, as well as your kidneys, as well as essentially starting this angiogenesis. Now, I'm not sure you can all see this, but I want to kind of go through kind of how things move around in the environment so you might know what you're up against here now. So you've had this catastrophic release. I'm very sorry for you. And you're just one. You're probably the first major release of the United States. Hopefully, we can prevent these releases from occurring in the future. Anyway, so it goes into your surface water. As soon as it gets into the surface water, some of it is going to start getting into the sediment of the river, right? It's going to sediment out because this is essentially a particulate, and if you drop particulate in a fluid, it's going to start settling according to its density and its particle size. What also happens is that some of it then is going to get out on the soil, and some of it is essentially, as I've seen and you all know, is drying as we speak, correct?
Yes.
Yes, it's drying. So as it dries, the wind is going to pick it up and aerosolize it and put it into the air. So you have a major route of inhalation